Teresa Gorman, and I work at the IAFF Health and Safety Department. My background is in industrial hygiene and occupational health and safety. Before I came to the IAFF, I worked with the World Trade Center Health Registry in the New York City Department of Health for a couple of years. And my dad is a retired firefighter from New York City, so that's how I got involved in World Trade Center health issues. So I'm just going to talk briefly about some new 9/11 legislation that was passed and two new resources for 9/11 responders, the World Trade Center Health Program and the 9/11 Victims Compensation Act. The James's Droga Act was signed into law in 2011, and it allocates federal funds to provide healthcare and financial assistance to workers and residents affected by 9/11. The Droga Act reopened the Victims Compensation Fund. It established the World Trade Center Health Program, and it created a list of health conditions to be covered by these programs. The 9/11 Victims Compensation Fund provides financial assistance to sick or injured 9/11 workers and families of deceased workers. There's an important deadline approaching for this program. If you are diagnosed with an illness or injury as a result of your work on 9/11 before October 3rd of 2011, you have to register with the fund by October 3rd of this year. So typically, the fund gives you 2 years from the time you were diagnosed, from the time you can register with the fund. So if you had an injury or illness before 2011, you have until 2013 to register. Registering with the fund, it's just putting the fund on notice that you were there and you were injured, and then you can file a claim later on at another point. In your handouts, you have a fact sheet about the Victims Compensation Fund, which explains how to register and how to get the application. You can go on their website, vcf.gov, for some more information. The World Trade Center Health Program provides rescue recovery workers with a free annual medical monitoring exam and free treatment for any health conditions and cancers that are related to your World Trade Center exposure. Any firefighter who worked or volunteered your own time at the World Trade Center, the Pentagon, and Shanksville, Pennsylvania crash sites are eligible to enroll. This includes FEMA and federal firefighters and behavioral health response teams and crisis counseling units. Some of you, especially if you're from the New York City area, you may have already enrolled in a World Trade Center medical monitoring program. And if you did, your enrollment is automatically transferred to this new program, so you don't have to do anything. A new aspect of the World Trade Center Health Program is that it's open to anybody in the United States. And the program works with a nationwide network provider that has clinic locations throughout the United States. So when you enroll, they will refer you to a clinic near your home, so you don't have to travel to New York City to be seen by a physician. I'm just going to briefly go over some of the eligibility requirements. For World Trade Center responders, you had to work at least 1 day. And I want to clarify that 1 day means a minimum of 4 hours. So really, it's only 4 hours between September 11th and July 31st of 2002. And you had to work at anywhere in Lower Manhattan or in the World Trade Center site itself or the surrounding areas. For Pentagon responders, you had to work at least 1 day from September 11th, 2001 through November 19th, 2001 at the Pentagon office building and surrounding areas. For Shanksville, Pennsylvania responders, again, at least 1 day from September 11th through October 3rd, 2001. Like I said before, the World Trade Center Health Program only provides treatment for those conditions that are specified by the Droga Act, and that includes airway and digestive disorders such as asthma and chronic cough, laryngitis, and gastroesophageal reflux, mental health conditions such as PTSD, anxiety, and substance abuse, and certain cancers. Last year, cancer was added to that list of health conditions covered by the program, and in order for your cancer to be covered, your physician and the program administrator has to first certify that your cancer was caused by your work on 9/11, and they do this based on your medical history. And then once it's certified, the program will pay for approved cancer treatment, drugs, and other services. So this is a list of cancers that are now covered by the program. Many cancers are covered, but not all. Brain cancer is not covered, for example, and neither is prostate cancer. You can enroll in the program even though you are not sick. You don't have to have any health conditions right now to apply for the program. The medical screening is specifically designed to detect these World Trade Center related health conditions, so it may detect some problems that you're not aware of. And the more people that enroll in the program, the more information we learn, and the more we can learn about the type of exposures that firefighters had on 9/11 and the health effects related to that exposure. So how to enroll in the program. Up here at the table, there's 3 different applications. There's one application for World Trade Center responders, another for Pentagon and Shanksville responders, and one for FDNY responders only. So you can come up here and grab some applications. You must provide some documentation and proof that you worked at a World Trade Center or 9/11 site. And also in your handouts, there is a fact sheet describing the type of documentation that's acceptable and where to get that documentation. And they realized that it's been over 10 years since 9/11 now, so you may not have all the paperwork that you need to enroll in the program. That's okay. If you don't have the required documentation, all you can do is write an explanation about why you don't have it and what you did to get it in your application, and that'll usually be sufficient. And if it's not, the program staff will call you and give you a chance to get the appropriate documentation. So they will really work with you to get your application complete and get you enrolled in the program. If you need any more applications, you can get them at the CDC website, cdc.gov/WTC. And the IAFF recently got a grant to conduct some outreach activities to encourage our members to enroll. We're currently creating a 9/11 health website that's going to feature all of the eligibility information that I went over here. And we're going to have some more information about 9/11 related health conditions. And we're going to have some fact sheets and brochures that you can download and print out and distribute back to your members. And it's going live next week. So this is a screenshot of the website. It'll be wtc.iaff.org. And so look for some updates from the IAFF regarding this website. And I encourage you to go on it, and all information related to 9/11 health issues should be on there. And if you have any more questions, please call the Health and Safety Office and talk to me, and we will try and get you the information you need for your members. That's it. I'm going to let Dr. Brizant speak now, and then we'll have a Q&A. Thank you.
Thank you, Teresa. That was an excellent overview of, now we just have to get out of this, overview of the program. Just give me a minute, guys and gals. And there we go. All right, well, it's an honor to be here to give you guys an update on what's been happening health-wise. I think Teresa has explained to you that this program is available to any of the firefighters, EMS workers, first responders, regardless of which site they were at. Many people from your hometowns came there as either FEMA teams, USAR teams, had friends there, might have volunteered there with the appropriate documentation, which is not extensive. You or the people you represent can get into that program. People have said to us, well, the national program isn't as good as the FDNY program. Well, let me just tell you a little bit about that. In New York City, there are 2 programs. There's the FDNY program, and then there's the program coordinated by Mount Sinai for non-FDNY members. We meet on a monthly basis so that they can get all of our knowledge and we can get their knowledge, and so that the programs are identical in terms of what they cover, in terms of what they provide. The difference is that the FDNY program is more intact in terms of having very little longitudinal dropout and having really all 16,000 of our people in that program. We're very proud of that, but both programs are providing the same medical services. The national program was set up by NIOSH, and ever since it was set up, it too has been coming to our monthly meetings. So the national program, their main physician is David Tornberg, has protocols, treatments that are identical to ours. Now, they have to be administered slightly differently because they have a large network of clinics. So there are a few barriers in that program to get the treatment because it has to be approved up to national level. May take a little longer to get the treatment, but not, not in a prolonged fashion. And that treatment, again, is following the same protocols. So I think for those of your members who live in distant areas, this national program is going to be a real benefit to them. If they have problems, they should be in the program. If they were there and they don't have problems, as Teresa said, they should be in the program to get screening, all right? Because this screening is going to be ongoing. We want to be on top of these problems. I want to give you a little idea about some of the things that we found so that you can better explain to your members what might be occurring in them if they were down there. Beforehand, I want to talk about any conflict of interest that I have. I don't have any conflict of interest except receiving all of this support from the CDC and NIOSH to provide these programs. That's taxpayer dollars, and I thank each and every one of you for sending those taxpayer dollars on time. So we all know about 9/11, and I don't want to provide any graphic videos of which you've seen many, one even this morning, on that event. What I can tell you from the people that were down there, myself included, is that it was amazing how 2 towers, each 110 stories high, wound up collapsing like you've all seen, and left a rubble pile that was only 3 or 4 stories high. Where did the rest of it go? It was pulverized into particulate matter that was aerosolized, vaporized into the air, and that's what we breathed down there on that day and in the subsequent days that followed. All of those building materials didn't magically disappear. We have some of them in us, and that's the reason why this program needs to exist. I should also say that everybody concentrates on those 2 towers, myself included. I just did now when I was talking to you. Yet, at around 4 p.m. that afternoon, another tower, about 60 stories high, which had flames ongoing the entire day, collapsed. Almost no one ever mentions that. Where if that had been an isolated incident, that would dwarf most incidents that we know about in America. So that goes to show you the amazing amount of particulate matters, gases, chemicals that were released that day. What do we know about that? Well, we know that these particles, large and small, were incredibly alkaline in nature. In a volcano, the particles are mostly acid in nature. And for whatever reason, our mucous membranes in our nose, our mouth, our lungs, the membranes that coat our airways, are much more capable of withstanding an acid insult than an alkaline insult. And we believe that this, as well as the fact that the particles were jagged in their edges, is responsible for this chronic inflammation that has been ongoing in so many of the responders that were there that day. This is what the dust looks like when we put it on the table underneath a microscope. But this is many, many, many fold times magnified. The particles are essentially microscopic at somewhere between 10 and 100 microns in size. We could not see them with the naked eye, but we can inhale them. The particles were made up of building materials for the most part. Pulverized cement, gypsum, pulverized glass, asbestos, silicates, fibrous glass, heavy metals, and then all the gases that are liberated from a fire, from a collapse, from burning jet fuel, volatile organic compounds, polyaromatic hydrocarbons, dioxins, PCBs, the latter being known carcinogens. And at least in the fire department, we have 16,000 members firefighters, officers, and EMS workers, as well as a bunch of civilians that work for the fire department that were exposed to this. All told, it's estimated that about 60 to 70,000 first responders, rescue workers, and recovery workers were exposed, but that is a very rough number because besides for the fire department, nobody knows the entire population of people that were exposed. What amazes me always is how many people can get to an incident, all right, so fast. All right? This is how it breaks down for the 16,000 firefighters that I'm responsible for taking care of. Day one, in the morning of 9/11, all right, nearly 1,900 firefighters got down there. All right? That doesn't mean they were all there during the collapse, 343 of which died during the collapse. But 14 to 15% of this 16,000 workforce was able to get there the morning of 9/11 before noon, all right, when the dust cloud was at its peak. And over the next 36 hours, end of day one into the end of day two, an additional 60% of our workforce was able to get down to ground zero. That doesn't mean they were in a firehouse waiting to be called. That means they were at ground zero. This is amazing that 75% of the fire department was there in the first 2 days. The rains occurred on day three, the evening of day three. All right? That doesn't mean there was no dust, no chemical exposures after day three, but they were not anywhere near as significant as they were in the first 3 days. Of course, there's a lot of individual variation in that. You could have shown up there 5 months later for the first day and be crawling into a crevice that had not yet been explored, and you could be inhaling the same type of dust and chemicals that was there on the first day. So there's a lot of individual variation, but what we do know is that the most severe exposures were in those first 3 days, and 75% of our workforce was there. And, you know, I don't have to tell you as firefighters that firefighters have the best respirator on the planet. All right? They have self-contained breathing apparatus. It's like scuba gear, but for dry land. There's nothing better than that. All right? However, as you well know, even a 45-minute bottle, which is what FDNY has, really under work conditions only lasts about 15 to 18 minutes. Normally in a fire, at least in New York City, we have a lot of firefighters, so when your tank runs out, we bring in new firefighters, and only under extreme conditions do we bring in new bottles to the firefighters that have already been spent. But this was not the case. With this massive attack on New York City, on America, we could not get new bottles, we could not get the necessary equipment down there. So what they should have had for this type of exposure would be continued SCBA, and then at some point transitioning to P100 half-face respirators, which were not readily available until the end of the second week. Even then, for any of you people who have worn P100 respirators, they're not incredibly comfortable. You can't communicate to people through them. This is not the type of thing that can be worn every moment of the time that you're down there. And this is how those exposures occurred. If we were all in spacesuits, we would have gotten no exposure, but we would have been able to rescue and recover no one because you can't operate in a spacesuit. And this confirms the fact that when we surveyed firefighters, 56% say that they never wore a respirator on the first day, and same information is available to us for the first 2 weeks. And 26% said they rarely wore one. So in fact, roughly 82% of the workforce essentially never wore a mask or respirator at all during that first day, not counting those people that wore an SCBA for the first 15 minutes. So we know that there was particulate matters and gases down there to be exposed to. We know that people were not able to wear an SCBA or a spacesuit, so that they had the potential for being exposed. This slide is just one of many slides, the only one I'll show today, that confirms that firefighters were exposed. All right? Up till now, we've talked about the potential and the likelihood for exposure. This slide tells us that they were exposed. And this is a firefighter who worked down there nonstop for 3 weeks, all right, then developed acute respiratory failure. And only because of this program was he identified so rapidly, taken to the hospital so quickly, was intubated, and today is doing actually very well because of the rapid treatment that he got. He suffered from an acute respiratory failure due to eosinophilic pneumonitis, which is similar to what similar to what some of our Gulf War veterans have gotten while they were in Iraq. The reason why I'm showing this to you is because he was intubated. The hospital staff was able to lavage his lungs out to see what was down there, and these are 3 photographs going from left to right of an uncoated asbestos fiber, degraded fibrous glass, and fly ash particles, which is essentially pulverized cement. This was down in the bottom of his lungs. So we know that this stuff got down there. I say uncoated asbestos fiber. That's an important caveat because you're exposed to asbestos in varying degrees throughout your career, unfortunately. But when they've been down there for a long time, they typically get coated. This is uncoated, so that means it was an acute exposure. And from the very beginning, FDNY realized that there would be mental health consequences, respiratory consequences, and perhaps other consequences. So we set up our monitoring program and treatment program earlier than any of the other groups, including Mount Sinai and the National Health Program. We were treating the very first day, but our monitoring program started on October 1st, 2001, 4 weeks after 9/11. And we're the only group that has the benefit of having pre-9/11 World Trade Center health data. So I'd like to take a moment and say that this is one of the many benefits of the IAFF Wellness Fitness Initiative, an initiative that we at FDNY helped them to design. We're one of the 10 cities that helped them to design it in the mid-1990s. Part of that initiative was chest x-rays. Part of that initiative was pulmonary function tests. Part of that initiative is a whole host of tests just in case you're exposed to something. It's not just about wellness, it's also about setting a baseline so that we can look at you after the exposure to make certain you're still well. All right? When we were lobbying for this program in Congress, there were many people in Congress from 2001 through roughly about 2008. Teresa said the Zadroga legislation was passed in 2010 and the program started in 2011. Between 01 and 08, roughly, the typical statement from various different congressmen and senators was, oh, this is just a bunch of people with a cough. You know, we only are going to fund real disease. People with a cough or who, you know, just have a complaint. They didn't want to say this, but what they were basically saying is it's either minor or maybe it's, you know, not even true. It's our data from FDNY using the Wellness Fitness IAFF protocol and was able to show that this is real, that this is not just a bunch of people with a cough. And in your districts, in your cities, municipalities, if you're ever exposed to something catastrophic, you will need that data, both from a workers' comp view as well as from a view to working with your city administrators to demonstrate that this is not just a bunch of people complaining of a cough. Let me show you some of that data. How do we collect that data first? Well, this is very similar to the IAFF Wellness Fitness Program. A firefighter comes in, signs in, takes medical questionnaires, vital signs, blood pressure, heart rate, etc., does that spirometry, takes a big breath, breathes it out hard and fast, and we're able to get a very quick view of your breathing capacity and how fast the air is coming out. An excellent screening test for lung dysfunction. A cardiogram, a hearing test, a chest x-ray every 2 years, blood and urine tests. At that same time, at least at FDNY, we use that as an opportunity to update your immunizations. We do a Stairmaster test to see whether your aerobic capacity is good. A vision test. The physician goes over all of that information. Also, we do a mental health questionnaire to pick up PTSD, post-traumatic stress disorder, depression, etc. And a mental health counselor goes over that questionnaire. And then depending on what's found in the light blue, that would initiate, if there's any abnormalities, treatment referral options in the area that's necessary. Mental health treatment referral, physical health referrals, medications, benefits counseling if this might be a possibility with disability or workers' comp, and then a sign out and a reschedule annually. With the Wellness Fitness Initiative, this is what we did, and then we continued to do this in even a better, more robust way after 9/11. One of the big things that occurred after 9/11 that we were not doing prior to 9/11, with the federal money, we're able to keep this going for the retirees. And all of this information is packaged together. Why do I show you this? Well, A, I want to demonstrate to you the importance of the Wellness Fitness Initiative. But number two, I want to demonstrate to you that, at least at FDNY, and this is what I hope is going on in your cities as well, wellness fitness information is used two ways. The first and most important way is to take care of the person. That's what this is all about. Take care of that firefighter in front of you. Use that information, his or her own information, to make a diagnosis, make some treatment, referral options, do some counseling. Good things. But the other thing that it's used for is to put the whole picture together, right? So that we can answer a question that every firefighter asks us after 9/11. First question, how am I doing? But the second question, how are my buddies doing? And what are your plans, third question, to take care of me in the future? The only way we can answer those two questions is to put all this information together so that it's not just about one firefighter, it's about 16,000 firefighters. And for the IAFF, it's not just about one firefighter, it's about hundreds of thousands of firefighters. And you know, people vote with their feet. If the program is not serving people, they go elsewhere. This is the greatest labor management health partnership in the history of the world. And these numbers say it. We have reached out, nobody's forced to take these exams, between 10/1/2001 and February 2002, not shown here, shown here, we did 10,000 people, 10,000 firefighters and EMS workers. We didn't get to 6,000 of them. But by January of 2013, we've done a single baseline World Trade Center follow-up medical on 15,281 people. Not everyone was down there. That's 98% compliance. But look at this. For the second visit, we've got 95% compliance. For the third visit, 92% compliance. We've only recently started visit 4 through visit 6, and we're over 85% compliance already. All right. This is without spending a single dollar on advertisement. Every dollar that FDNY gets to run this program is spent on the healthcare program, not on advertisement. So our guys are voting with their feet, and they're saying this program is doing what it's supposed to do. So what have we found? Here in the, I don't have a pointer, but if you look towards your left, the first line, before we get to that giant red arrow going down, up until that, it starts in 1997. It goes to just before 9/11/01, and you can see a nice, slowly declining line. What is that? That is lung function. That is what is measured on the spirometry, on the pulmonary function test that's part of every World Trade Center medical, but is also part of the Wellness Fitness Initiative. This was the Wellness Fitness Initiative. And what we're documenting here is that firefighters, their lung function was declining at around 30 cc's per year, and that's not a bad thing. That's what we expect with normal aging. If you look at any American male, their lung function is declining between ages of about 25 and 70 at around 28 to 31 milliliters per year. All right? So this is telling us that SCBA is working. I know you don't use it all the time, I wish you did, but it's telling us that SCBA is working. All right? And it gives us a legitimate, objective baseline when we went to Congress. Because look what happened after 9/11. After 9/11, lung function declined in the first year 372 milliliters. That's 12 to 14 times what it was declining in these very same people in the years before. So we're not saying to Congress we expect it to be 30 milliliters in like everyone else, but we don't have any measurements. No, we had measurements in these guys. They were declining 30 milliliters per year, and now all of a sudden they've declined 372 milliliters. Well, that still wasn't good enough, because people said, well, it'll recover in the next year. No big deal. So we went on to our next study. Now, this is a different scale, so it looks smaller. But up until on the x-axis, on the bottom axis here, we have years. This is 9/11-01. Before 9/11, it was declining at about 30 milliliters per year. After 9/11-01, in the first year, it declined at 370 milliliters per year. But now this is the next 6.5 years. So we're taking that out 7 more years. And you can see that this is relatively a flat line. In fact, it's the same line that you would see if these guys were not exposed to the World Trade Center. It's the same roughly 30 milliliters decline. So this drop was 9/11 related and then did not recover in the majority of people. Well, some people said, oh, it's just the smokers, that's all. All right. Well, if you look at this, in the blue, you see the never smokers, and in the red, you see FDNY firefighters who ever smoked. And yeah, it's a little bit worse in smokers, but that little bit is dwarfed by the World Trade Center effect. This is not a disease of smokers. This is a disease of World Trade Center exposed people, first responders, in this respect, firefighters. We see essentially the same stuff in our EMS workers who were down there. This is a slide looking at a test for asthma, and if you have a positive, you're more likely to have asthma. It's what's called a methacholine challenge test. The blue is the people who were down there during the morning of 9/11, and in the red is the people that arrived after the first day. And what you can see is that you're more likely to be stuck with asthma 1 month, 3 months, 6 months, and I don't have data here, but we've shown the same thing 2 years later. You're about 25% more likely to have asthma if you were down there in the morning of 9/11. These are CAT scans. We are following the CAT scans on 4,000 of our most exposed firefighters, and we expect to expand that number shortly with a new federal program. But what we're seeing here is on the left panel, hard for you to see, but the airways are thicker than they're supposed to be, consistent with the inflammation you'd expect to see in asthma, chronic bronchitis, etc. On the right panel, with the borders marked in yellow, are areas of the lung that are overinflated due to the disease known as chronic obstructive pulmonary disease, and this may be an early onset of emphysema. So this data was critical in helping each individual firefighter, as well as getting all firefighters, both in New York City and across the nation, these benefits, as well as our EMS brothers and any of the other first responders that were down there. The good news is that the vast majority of this disease, World Trade Center cough syndrome is the moniker for it, can be treated, all right, using the same paradigms and protocols that we use for asthma and chronic cough in the community. All right? That's the good news. Can't make it go away, but we can dramatically improve people's quality of life, their symptoms, and to a lesser extent, their breathing capacity. How do we do that? Let me look at this slide first, and then I'll go back. All that is cough is not always asthma. It's not always bronchitis, chronic bronchitis, or lung disease. It may be the upper airway. Sinuses were just as affected as the lung. Acid reflux from swallowing this dust was also affected, and that is well known, even without World Trade Center exposure, that if you have a lot of sinus drip and have a lot of acid reflux, that you will have a chronic cough, and in fact, you may be likely to have more asthma. So this is like a self-fulfilling vicious cycle. Sinusitis and acid reflux can make asthma worse, or it can even cause asthma. World Trade Center dust can cause 1, 2, or 3 of these issues: sinusitis, GERD, asthma. Good news, like I said, the same medicines that treat this in somebody with allergies or somebody with asthma for another reason or sinusitis for another reason will, for the most part, work here. So with acid reflux, we use a diet, we use staying away from acid foods, getting rid of alcohol, proton pump inhibitors like the purple pill Nexium that you hear about on TV. For sinus treatment, we use nasal steroids, nasal decongestants, cough suppressants, antibiotics. And what has surprised me completely, but you need an open mind, is that the firefighters tell us that the saltwater wash is the most effective thing for their sinus congestion and drip. Not the salt water that you just spray, but you actually do a sort of lavage. You fill up a bottle, put a saltwater packet in it. Some of your mothers used to probably do this and call it the neti pot. That's just one brand name. The neti pot you have to spill. I don't particularly like that. We use one with a squeeze bottle that we squeeze up into it. I think neti pot makes one like that too. We use a different version called Nasal Care. They're all the same. And that is pushed up into your nose gingerly, and then it drips down, and the firefighters have said that that's just as good, if not better, than many of the nasal steroids and decongestants that we use. But we also have to treat asthma, which may be coexistent or be the only issue. And again, with that, we use standard asthma treatments, bronchodilators, inhaled steroids, a fancy thing called leukotriene receptor antagonist, which you hear about on TV, which is marketed as Singulair. You may have family members that use some of these drugs for asthma or allergies. We use the same ones. Because this sort of takes up about 99% of the lung disease associated with asthma, that's what we do first. If there's no response or if the chest x-ray was abnormal, then we look on the left side to see if there's been fibrosis, scarring. We were very worried that this was going to happen in large numbers of firefighters. Well, thankfully, we've only seen it in about 10, 2 of whom were so bad that they needed lung transplant. 2 others were so bad they needed lung transplant, but they were too old to qualify for lung transplantation. And currently, of those 4 people, 3 are now dead and 1 is still alive. If this had been an epidemic of what we call pulmonary fibrosis or pneumonitis, it would have been a tragedy that none of us could even imagine. Luckily, this has been an isolated few, and we're watching this very closely. A group of firefighters has also come down with something called sarcoid or sarcoidosis. We were the first to show that firefighters have increased sarcoidosis prior to 9/11. Again, using that data, we were able to compare what happened after 9/11, and we found that sarcoidosis was even increased more after 9/11 than it was before 9/11. Again, this is not an epidemic. There are thousands and thousands of firefighters who've been coming down with World Trade Center cough syndrome from asthma, sinus, and GERD. Luckily, only about 10 to 20 with pulmonary fibrosis, and only about 30 to 40 with sarcoidosis. For those of you who are interested, this is what sarcoidosis looks on chest X-ray and CAT scan. For many people, it is asymptomatic. The most serious issue with sarcoidosis for the vast majority of people who are diagnosed with sarcoidosis is the initial anxiety of whether they have cancer. Because although this is a classic presentation on X-ray for sarcoidosis, we cannot with 100% certainty just from the X-ray tell you that it's not lymphoma. So until a biopsy is done, there's a huge amount of anxiety, understandably so. Young people get both lymphoma and sarcoid. We don't want to miss lymphoma because that's very treatable, so we don't want to just say this is sarcoidosis. So we go on to biopsy, and then once the biopsy confirms sarcoidosis and people go for a year or so and don't have any symptoms, their anxiety level calms down dramatically. As I say, most people, sarcoidosis is an asymptomatic disease, not resulting in duty determination changes or in disability. But in some people, sarcoidosis can be very disabling, can cause serious shortness of breath, but can also cause disease outside of the lungs. Can affect the eyes, the heart, reproductive function, liver, can affect every organ of the body. Unusual, but that can happen. And then, of course, it's an extreme disability, and in rare instances, life-threatening. Since 9/11, we've seen more of that type of sarcoid than the asymptomatic sarcoid. Prior to 9/11, our firefighters had an increased rate of sarcoidosis, but they tended to have asymptomatic sarcoidosis. Since 9/11, they've had a much more symptomatic version of sarcoidosis. We have one firefighter with cardiac sarcoid, an incredibly rare disease. He's required a pacemaker and a defibrillator, fully disabled off the job. We have about 8 firefighters with sarcoidosis affecting their joints, also fully disabled, requiring very expensive treatment to keep them under control. All in all, we've had over 1,400, this is data up until just 2008, I apologize for not getting this up to date. We've had over 1,400, probably closer to about 1,600 people who have gotten disability benefits at the cost of millions and millions of dollars. And we were thinking about cancer, and I'm going to close with these cancer remarks, from day one, because of the exposures to carcinogenic agents, aromatic amines, PCBs, polyaromatic hydrocarbons, dioxins. So we were following cancer very closely, and once again, we were the first to report an increased incidence of cancer. And this was published in 2011 in Lancet, and we're proud of this, not because firefighters are coming down with cancer, but because this was a solemn promise that we made to the firefighters when they came out of those buildings, when they went back there on the subsequent days, that our program would be there for them, that our program would provide them with the state-of-the-art care, and that none of what we find would be covered up. And there was an increased incidence of cancer. In this group, you would have expected over the first, this is only a 7-year study from 2001 to 2008, because it takes so long to get the cancer data, but you would have expected 238 cancers based on national expectations from other databases, and we had 263. I want to make it clear to you that there's not an epidemic of cancer, but there is an increased rate of cancer. Somewhere, depending how you measure it, somewhere about 19 to 30% higher than what you'd expect. Not twofold, not threefold, not fivefold, not 50-fold like you see with asbestos and cigarette smoking, all right, but a 19 to 30% increase, which is significant, especially if you're one of the people who have it. People questioned our study, rightfully so. You should always question a study. The first people out of the box always have the most questions, but this data was substantiated by the other groups that are looking at things approximately 2 years later by the World Trade Center Health Registry that you used to work for, and about a year after that by the Mount Sinai group, looking at their data. Always good to have the findings substantiated by other groups, especially when they come second and third. So to sum up, lessons learned from the World Trade Center attack, the importance of the Wellness Fitness Initiative. But also, you need to have a cleanup plan and a reentry plan. We needed to get half-face P100 respirators to people sooner. We needed to make certain, to the best of our ability as supervisors, that they wore them. We need to rotate people more rapidly out of those areas. It's very hard when they're looking for 343 of their own fallen brothers and sisters. I get it, but this is the consequences of that. It's nobody's fault, but next time around, we need to do better. We need to register all workers at a disaster site. We didn't do that. The fire department had its own data, but the other people, they're lucky, as Teresa said, that the federal program is constructed in such a way that they don't need to have photographs of having been down there. It could have been constructed requiring photographs. We should never be in that situation again. It is so easy nowadays to have electronic coding of an ID card and you bar swipe as you go into the area of the disaster, and that would document people's position there. It would document how many hours they were there. You know, the costs were huge to do that, 20, 30 years ago. The costs are infinitesimally small to do it now. And nothing is possible without mobilizing broad support. The IAFF was there with us from day one. They were there with us in Congress, with the Senate, with the President, constantly fighting the battle to make certain that the Zadroga program becomes a reality. As Teresa said, because of that, we are able to cover musculoskeletal injuries if they occurred on 9/11 and were reported within the first 2 years. We're able to cover upper respiratory, lower respiratory disease, mental health disease, cancer. 50 types have been added. Teresa was giving you the most recent accurate information, but it appears that prostate cancer will be added. The administrator of the World Trade Center Health Program has put out a statement that he is inclined to add prostate cancer, again, based on our data substantiated now by the two other groups. And he's in a public response period right now. So once that, and those comments are closed now, they've finished. Now he has 60 days to review that, and it's our anticipation that at that time prostate cancer will be added. With that, I want to thank you all, and we're here for questions. I know but we have about 10 minutes since, or longer if you need it, to wrap up with questions. Yes?
I'm just wondering, I have two questions. Is this data available to us to bring to our whoever we need to?
Yes. All of this data has been published, and those publications are available on the NIOSH World Trade Center website, the CDC/WTC, and they'll also be available on the IAFF website, I'm certain.
And what would we need to bring to our physicians and stuff like that for tracking purposes?
Well, for tracking purposes, to do World Trade Center or to do the next,
Just to know
what they should be doing for every fire, because every fire is a potential disaster. Absolutely. Wellness Fitness Initiative. If you follow the Wellness Fitness Initiative, you will get the necessary testing going forward, all right? And that's what we're doing, all right?
I've got a couple as well.
Sure.
With the decrease in pulmonary functions, you said that within that year, they basically, or it was found, it was about a 12 times, so like
Decrease.
12-year decrease basically in 1 year.
Yes.
Were the workers noticing that anecdotally, or was that something that you didn't actually pick up until they did the...
That's an outstanding question. People who were symptomatic, very symptomatic, noticing it tremendously, had an even greater decrease in pulmonary function. That's an averaged for the entire 16,000. So yeah, if you're super symptomatic, you will have closer to 1,000 milliliter drop. But even at 372, you will notice that with exertion. Normal human beings will not notice a 372 at rest, but firefighters, they're doing exertion. So most of the time they'll notice it.
My second question was, at the time, did the powers that be, like whether yourself or you know, government officials or whatever, did people know that these workers were being exposed while they were down there, not on SCBA, not on respirators, and they just, you had to get done, so you just let it happen, or like that? Like, what was the thought process on day one, or day 2, 3?
Sure. This is a very complicated thing. You know, there could be, and I'm not trying to cover up anything. I'm telling you that I'm in a position where I make policy about the future too. And I have to tell you, this is very complex. People have quoted, shown videos of the EPA administrator saying that it's safe to return. All right? And that clearly was the wrong public message. It's the wrong public message for any disaster like this. She now claims that that's a soundbite that was taken out of context. I'm not here to defend her. I'm just saying that it's a complex situation. From our perspective at FDNY, we wanted those half-face respirators as fast as possible, but we couldn't postpone going in there during the first 10 days when it's known that you can have a rescue effect, all right? Thereafter, we wanted to reduce exposures. We had the half-face respirators. Do we pull somebody out who's not using one? You know, in retrospect, respirators are only as good as supervision. However, people are looking for their loved ones. You know, this is different than Oklahoma, where in Oklahoma only one first responder was killed, a nurse, by falling concrete. Here we had 343 firefighters, 2 of whom were paramedics. We had 60 police officers from various different branches. Many of these people are not just brothers in terms of service, but they're actual brothers. One of the people I just told you who's died of pulmonary fibrosis, he was actually retired before 9/11 and was down there searching for his son, whom he never found. Right? So these are complicated issues when you try to bring the theoretical into reality. People knew about these exposures. They didn't know they would be this bad, all right? And they made decisions. In the back.
Initiative was 343. Now, since then, how many additionally have passed that are directly related to this? And is there any kind of prediction, because I believe the latency period for asbestosis being completely ill is like 15 to 20 years.
Yeah.
Are you all anticipating?
So just to repeat that question, how many have died that are World Trade Center related? You know, from the direct effects of World Trade Center, i.e. lung disease, cancer, I don't have the exact number because we publish it every September. We have a ceremony 9/11 where we add to a separate wall at the fire department. We have a wall on this side where you died during the fire, including the World Trade Center. Then we have a wall on the other side where you've died since then. It's over 60 people. The exact number we'll be publishing again, you know, each September. But you're absolutely right about the latency period of asbestos. It's usually 20 to 30 years. You don't typically see asbestos-related deaths for the first 15 years. So we have to continue our vigilance here. That's why the Zadroga legislation is important. That's why it has to be reauthorized for it to be continued in 2016. Another political battle that we'll have to fight at that time with the IAFF. Yes.
From Ottawa, Canada, so we had a lot of guys throughout the country that went down to New York. Obviously, you know, we wouldn't want like financial
Understood.
from the program, but is there a recommendation that you could give us for what we can do for our guys? Either, registering with you guys just for tracking purposes, or for recommendations, what we can give them, how we can
Right.
track them.
Yeah, that's a question Teresa will look into to find out if you can register.
You can. Canadian firefighters are eligible to apply for the program. The only thing is that there's no clinic sites in Canada, so you would have to come to the closest clinic location in the U.S., and the program doesn't cover travel expense reimbursements, but you can still enroll. You fill out the application just as normal and submit your documentation, and there's already Canadian responders enrolled in the program, so you can definitely enroll.
But let's say they can't travel too far, Calgary or whatever, can we just give them recommendations, because we have Medicare, and they could probably get the treatment, and have the cost at least covered?
Mm-hmm.
So yes, the recommendations, I lecture throughout Canada. There are some outstanding pulmonary groups in Canada. All of them are very knowledgeable on how to treat World Trade Center related lung disease. Canada actually has 2 or 3 of the world's most famous pulmonary departments. All right, one in Winnipeg, another one in Montreal, another one in Toronto. I mean, really top notch. So we're actually learning from them a lot of times. So, and all of this information about how to treat this has been published and is on my website at the fire department. It's also on the CDC website. There's also a guideline on how to treat chronic cough from the American College of Chest Physicians. That was co-written by a Canadian doctor, Dr. Susan Torlow, and it's very applicable to all of this. Thank you. Question in the middle.
We've been following you as the Firefighter Campus Support Network with, and we thank you for that. Teresa, real quick question. Being registered with WTC, does this automatically roll you over into the other?
It does not. They're 2 separate programs, 2 separate registration forms. So enrolling in one does not automatically enroll you in the other. Yeah. You're welcome.
You have to enroll in both. The only good news about being in the World Trade Center Health Program is that if you're in that program and you then enroll on your own, you have to enroll on your own in the Victims' Compensation Fund, but if you're in the World Trade Center Health Program, your medical records from that program are automatically transferred. That's the only advantage. You still have to enroll in both. I thank you all for your interest, and I hope you have a great time in Denver and at the rest of the meeting.